help here with the project. So that's why I will do the main part in English, but for the questions and discussion, you always can switch to the Swahili. Next. This is to show that I have no conflict of interest and that I get some money everywhere. That's what they usually request in the Netherlands, and here even to get CPD points that you're not paid. Also no sponsor, only the sponsorship we got for this workshop. Next. This is what we're going to do today. We're going to we'll go to this was already the welcome introduction. We do a short part on cardiovascular disease. What is it? What are risk factors? What you can do to prevent? I tip a little bit from the communication, but that will be in the workshop later. And I end with a take-home message. Next. The burden of cardiovascular disease in Tanzania is high, and we realized in the past 2 years that many people are not aware of that. And it's one of the main killers in the group of non-communicable disease. And there are risk factors like smoking, obesity, hypertension, diabetes, and unhealthy diet.
Just continue. This is taken care.
And next. What is a cardiovascular disease? Cardiovascular disease is a group of disorders of the heart and the blood vessels, and includes coronary artery disease, cerebrovascular disease, rheumatic heart disease, with also other conditions. Four main groups are coronary heart disease, which involves the blood vessels of the heart muscle, the cerebrovascular disease, which involves the brain vessels, the peripheral arterial disease, which involves the veins and the arterioles going to the legs and the arms, and the deep venous thrombosis and pulmonary embolism, which involves the veins, not the arterioles, but the veins when there's any clots. Cardiovascular diseases is the main world killer in the whole world, but it's also getting increased in Tanzania. You can see here in cardiovascular disease is the main, and then cancer, respiratory disease, and HIV, which used to be very large, has become very small. And the problem is that it's more than 75% worldwide is happening in low and middle income countries. Yes. Over time, if you have chronic hypertension, it can involve in end organ disease. And what is end organ disease? It means it can involve cause myocardial infarction. It can involve stroke. The veins go to the brain. It can, with that, it can involve cognitive impairment, decline, left ventricular hypertrophy. That means your heart is getting very large and has a problem to have a pump function. The kidneys can get impaired. There can be problems in your eyes. We call it renal impairment. Hypertensive retinopathy, that means the back of your eye will get involved, and of course there is possibility of get peripheral arterial disease, and in whole a lot of arteries can become stiff. In Tanzania, the common cause of heart failure is hypertensive heart disease. That means if you have hypertension for a longer period, the heart will have problems to pump, and in the first degree, there is no signs. The heart muscle has not become bigger, and there also is no different lung function. But in the second degree, the hypertrophy of the ventricle is starting, and it can be with or without symptoms. And in the third degree, there is congestive heart failure, which means there will be less function of the heart, or it's without a reduced ejection fraction. That is for the doctors mainly important to see whether you have a treatment possibility. If there is a reduced ejection fraction, it's usually possible to give certain medication like ACE inhibitors. Well, without, they will not work. The risk factors, because that was the main theme of this lecture, and there are modifiable risk factors. That means you can change them yourself. There are like unhealthy diets, physical inactivity, tobacco use, alcohol use. And there are intermediate risk factors. That means that are measurable risk factors. They have sometimes causes which can be influenced, like overweight or obesity. You can measure hypertension, abnormal blood fats, like cholesterol, and hyperglycemia or diabetes, and large glucose in the blood. You can even divide them in modifiable and non-modifiable, because only non-modifiable you cannot change. Wees op babisha ni umri na ini risk factor kwa na sex wanawake mara nyingi wakati wanafika muda ya kama 40 wana nafasi zaidi kuliko kabla. Ethnicity, there are some people who are more at risk because of the genes, but also the place where they come from. And that is part of your blue zone. Also, we'll talk about it later. But the modifier risk factors is high blood pressure, the body weight. You can measure with high body mass index. The diabetes, although it's known to, it's a disease which has genetic factors, we also know that it's modifiable by diet and by exercise. Kidney dysfunction is modifiable by lifestyle, but also by medication, and the cholesterol is modifiable also by diet and if necessary by medication. But they're still metabolic. It's either modifiable, but they come from your body. The behavioral is the diet, the smoking, the alcohol consumption, and the physical activity. And then we also have environmental risk factors, which include air pollution and stress. If you're working in a stressful situation, there's more a risk of getting heart disease than if you have a enjoyable life. We know that there's a risk for that. Even if you live in a poor situation, the risk is even higher than not. Next. And then I wanted to divide them a little bit on risk factors which are traditional. Everybody will teach them: hypertension, overweight, you've already seen them, cholesterol, smoking, stress. But if you look to low and middle income countries, sub-Saharan Africa, we know there's also an influence on inflammation. We start to know there's more known about inflammation is causing also heart disease. There's a risk factor in poverty, and there's a risk factor in industrialization. People who live in the towns and in the areas which have more industries are more likely to get cardiovascular disease. So where you live also matters. One of the risk factors we usually, where screening is hypertension and large blood pressure, it's important to notice that you have to check it on three different times to know what is the mean and what is the real one, because if you check it when somebody's in stress or is just done something, then it might be larger. And then we have like three classes: hypertension class 1, grade 1 is 140 above 159, right? Or 90 systolic, and 90 until 99 when it's diastolic. Hypertension grade 2 is 160 up to 180, before 180, and grade 3 is above 180, with diastolic above 110. And next. The importance of that is that it has different action you need. If the hypertension is grade 1, like it's less than 140, you can change lifestyle. The lifestyle can be changed, and that one is okay. The target is 140 up to 80. And the action, you start with lifestyle advices. We will talk about that more today. And then there is also a hypertensive crisis, which means the blood pressure is very high, but it's not only the blood pressure which is high. Blood pressure itself is not a disease. Hypertension is a risk factor. So, kama simpisi Adamu ni juu sana, na pia una shida kama unasikia maumivu ya moyo, you have problems of pain, then it's there's more. We call it's a hypertensive crisis when the blood pressure is very high and there are some complaints, and there might be almost end organ damage coming. So then you need immediate treatment of IV treatment. And if there is hypertension together with albuminuria, that means the kidneys are passing albumin proteins, or you are diabetic, then also it has some implementation of the action. For the then you start an ACE inhibitor, for example, if there is probably damage, and in diabetes. Without problems of in older people we prefer to start a calcium inhibitor. It's better for older age. So every group has its own preference of medication or action. Overweight, which has a prevalence in Tanzania 15.6 up to 33.5% Pacific, so it depends in the rural area that's less than in the urban area. What is it? It means the body weight is more than 10% above the ideal weight, the assumed what is good for your health. And in figures it will be the body mass index more than 25 kg per square meter. When we call it obesity, adipositas, it means that body mass index is more than 30 kg per square meter. And nowadays it's also easy to look at abdominal obesity, which you can measure by doing the circumference of the abdomen. And then for men it should be less than 102 centimeters, and for women it should be less than 88 centimeters. So there's a difference also, like for abdominal fat for women is more risky than for men. There was something falling off, it was something. Oh, it's here.
Is there any?
Yeah, it went there, I can see.
So,
No, I'm not, yeah, maybe can. Yeah, it was on the words on the right side. Yeah, that's thank you. Next. Yeah. Diabetes now, like this disease, like prevalence, we say in diabetes, the number of how much is there? It's estimated to be almost 10% of the adult people, because they take the age above 20. And on the moment there are about 2.9 cases of diabetes to expect in Tanzania, and the expected death rate coming from diabetes is 21%, and it's again in the group of adults from 20 to 79 years. We estimate there's a lot of diabetes non-diagnosed in Tanzania. That's a main reason also during the screening we were taking blood glucose to see if people are having diabetes. And the type 2 is really related with lifestyle. There are like type 5 diabetes. Type 2 is, I think, the main in Tanzania here, and it's related with obesity, but also with inactivity, with smoking and alcohol use. And there's another new form of diabetes. It's recently recognized by the WHO, and it's related with childhood malnutrition. So children who were malnutrition in the first years, later on they have a higher chance to get diabetes. And I think before they were considered as type 2 diabetes, nowadays we know it's they're part of type 5 diabetes. Smoking and tobacco use in Tanzania, 14% of the adults, mostly men, and a few women are smoking. They did some research in some areas and they noticed that there's a relationship between smoking and low level of education and poverty. So people are smoking who have more smoking if they have less resources, and it's a risk factor, a main risk factor for cardiovascular disease, but also other chronic disease, like pulmonary disease, like emphysema, chronic bronchitis, lung cancer, and it also has a big influence on recovery from wounds. So it has a whole impact. Next. Also, alcohol use is associated with more risks of increased cardiovascular disease. We know it's more chance of get hypertension, but also of clotting, which is the cause of, for example, a myocardial heart or a stroke. But also it's associated with rhythm disorders like atrial fibrillation and bleedings of the brain, and hemorrhagic stroke. And the prevalence, is the number, the percentage of alcohol consumption in Tanzania is almost 30%, and it's associated with stroke, heart disease, hypertension, more than heavy alcohol consumption is considered is associated with greater risk. And so the stroke, the another rate is 30. So it's not like if you drink a lot, there's more chance for you to get cardiovascular disease. So to summarize, what can you do to prevent cardiovascular disease? Number one, I put no smoking. Smoking, I think, is a very high risk factor. Another thing you can do is daily physical exercise. That means at least 1.5 hour a day being active, and at least 3 times a week sweating because of exercise.
Then there is the healthy diet, which should consider high fiber, vegetables, fruits, brown bread, low fat and low salt. That are the general, but we hear today more on a healthy diet. Reduce or stop alcohol use. You can treat hypertension and hypercholesterolemia. You can treat that with medication, but also we know that exercise and diet will be able to reduce blood pressure. Then stress reduction and sufficient of sleep is very important to reduce your risk. And awareness and early recognition. So knowing early and working on your risk factor is helpful in preventing. And then a good news of this whole issue is that the traditional Tanzanian food which contains fish, nuts, beans, fruits, vegetables, and no artificial products, not from the factories, is actually already healthy diet. So it's not difficult to reach, at least the diet. The other things might be more difficult. Next. The physical exercise we'll do later on the special workshop with Walter has come in. But to give some examples, what you can do is walking or biking at least every day 30 minutes. If somebody is not able to walk, you can advise him to do chair exercises, and even being involved in domestic activities helpful, like gardening, which can be physical, ask physical strength, but also you can visit a physiotherapist and get advice. And nowadays, in Holland, a lot of people go to groups to do exercise together. And I know in some areas they have started that already, like to have small groups to exercise together. And Nadine is planning to start a group here when she will come in here in October. Yes, next. Healthy diet. When we keep the advice simple, we usually say half your plate should be vegetables and fruits, and a quarter should be protein, and a quarter should be other things, such as we call it in Fuka Zayumba, the things which has carbohydrates like sugars in it. That should be only less than the use of traditional food, the Kilimanjaro diet of Chaka, which is a mix of plants and fibers, beans, green vegetables. They have a fermented banana drink, and they noticed that there was already a reduction of inflammation and related biomarkers. So it's not like a long period, but after a short time they could see a difference. I put the reference in here. Next. Last year we had in Boomba we noticed that stress is common in caregivers, and in people with low income, and those with chronic illness. So if you're already in a risk situation, it also the stress is adding to the risk. And there are some support groups for stress reduction, and in the healthcare we can also refer to pastors, social workers, or if available psychologists to help with stress reduction. Yes. Then I want to end with the positive communication, because communication, we have a workshop later, but it builds on trust, it will reduce anxiety, and it provides emotional support. Communication itself can be considered as a treatment. We know there's a difference. If you're kind to a patient, you show empathy, or you're not kind to a patient. If you look at those two groups, the people who are not treated nicely will recover less. So the way you treat the patient has also effect on the medication you prescribe. It's important also for the patient to follow your advice, but it also helps. You can try it out at home. If your husband or your family or your child is having suffering from something, it will improve much better if you be kind and understanding, and if you start saying, there's no, but Hanashida and the rest too. Communication is important also to discuss prognosis. Good communication to show what is the option, what are the risks, what kind of treatment do we need, the shared decision making we try to prefer, and it improves adherence to medication. If you have a good communication with the patient, the chance is higher that he will follow your medication prescription. If he doesn't trust you through the communication, he might, after the visit in the OPD, he might go to another doctor. So it's important for your patient-provider relationship, which is important in follow-up of problems, and especially chronic heart disease, which are chronic problems. It's good to build up a good patient-provider relationship. Yes. How can we effectively communicate about lifestyle changes? We're going to have a whole workshop on that. But there are several techniques in good communication. There is motivational interviewing is a way, or the way you start discussing it is not like telling somebody what is good, but asking somebody what he thinks is good for him. So that helps the person to change his behavior. In communication, we can use flyers and pictures to make it more clear what is the message. It's very important to be aware of health concepts and beliefs. For example, if somebody thinks he has a heart disease because he has done something wrong, or his family has done something wrong, it doesn't help to deny that. It's good to give credit to that
what he believes, and still that he might be much more open for your advices. And according to the WHO, there is the 5 A's on how you can counsel for behavioral change. And it's in asking, you ask what for the patients are the relevant risk factors. You have to assess if somebody is already ready to change, because you cannot advise somebody who's not ready to change, so you ask. You can give advices, give information on the risk factors, on what can be done, and you can help him, assist with the plan, and encourage on that plan. And arrange is the way you follow up on it. You make an appointment to come back to set goals and to see what happens next. So that's part of the WHO guideline on change, behavior change. Next. So the take-home message, heart and vascular disease, on the moment in the world stop cause of death, they're a main killer in the world, but also they are a very major challenge in Tanzania. In adult death, if we not consider the death of the children, then it's also the main reason of death. Prevention is possible in the West-Africa by reducing risk factors, lifestyle, food, and a holistic approach. So also attention to environment, to stress, food. The family sleeping is very important. It's not only the medicine what can help the patient to prevent cardiovascular disease or even to recover from a cardiac problem. You need to look at the holistic plan. I think that was my presentation. Next is the references. For now, are there any questions? Or we collect the questions on the...
Yeah, questions, then you ask them if you have any other question or any comment or additions to the topic. Kama una swali, kuna sehemu unataka upate ufafanuzi au kuna nyongeza, tumekubaliana kutoka mwanzo kwenye sehemu utamaduni wetu. Hii ni washa. Kwa maana nyingine ni kwamba sio tu tunafundishwa, lakini hata sisi tunachangia kama kuna jambo katika mtendea leo tunaongea. Tunaweza kumaliza hizo kidogo kwenye chai.
Naomba hii swali unaweza kufanya kwa Kiswahili, labda kutafsiri kidogo kwa Kiingereza kama watu wa Holanzi watasoma hii masomo baadaye. So we can do the question in English and then maybe do some translation on. You can do the questions in Swahili and translate in English. Any questions? Maswali?
Maybe not a question, but addition on the risk factors. First of all, thank you very much, Dr. Maya, for your nice presentation, and you passed through a lot of stuff, the risks, vascular diseases, and all the good quick information. I wanted to comment something on the risk factors. Most of them, they are interrelated to each other. Actually,